Welcome back, all of you, to Government Nursing Officer Exams Preparation Mock Test Explanation Series, Part 31. The first question: Type 1 hypersensitivity is mediated by option A, immunoglobulin G, option B, immunoglobulin E, option C, immunoglobulin M, and option D, immunoglobulin A. Let us see the right answer. The right answer is option B, immunoglobulin E. Hypersensitivity reactions are type 1, type 2, type 3, and type 4. Type 1 is immediate and it is mediated by immunoglobulin E. Type 2 is cytotoxic and it is mediated by immunoglobulin G and immunoglobulin M. Type 3 is immune complex reaction and which is mediated by immunoglobulin G, immunoglobulin M, and immunoglobulin A. And the type 4 is delayed reaction and it is T cell mediated. Next question: when does the anterior fontanelle close in the child? Option A, 6 to 8 weeks. Option B, 6 to 8 months. Option C, 12 to 18 months. And option D is 12 to 18 weeks. The right answer here is option C, 12 to 18 months. Brachma and lambda. Brachma is the anterior fontanelle, lambda is the posterior fontanelle. This comparative study will enable you to remember it in a better way. Brachma anterior fontanelle is diamond shaped. It is having diameter of 2 to 4 cm and it fuses at 12 to 18 months, which is the answer. Here in lambda, it is posterior fontanelle. It is triangular shaped. It is diameter having 1 to 1.5 cm and it fuses at 1 to 3 months. This is the diagram to remember brachma and lambda. Brachma is the anterior and lambda is the posterior one. The memory tips is also given here with the short forms. Remember this: BAD 12 to 18, LPT 1 to 3. Brachma is anterior fontanelle. It is diamond shaped and it is fuses at 12 to 18 months. That is BAD 12 18. And LPT 13 is lambda posterior fontanelle, triangular shaped and fuses at 1 to 3 months. Next question: who is considered as the father of sociology? Option A, August Comet. Option B, McClure. Option C, Emile Durkheim. And option D, Kingsley Davis. Let us see the right answer. The right answer is option A, August Comet. August Comet is widely recognized as the father of sociology. He was a French philosopher and social theorist who is credited with establishing sociology as a scientific study of society. Which of the following is not a component of kangaroo mother care or KMC? This is the next question. Option A, skin-to-skin contact. Option B, supplementary nutrition. Option C, exclusive breastfeeding. And option D is early discharge and follow-up. The right answer here is option B, supplementary nutrition. Kangaroo mother care, KMC, emphasizes skin-to-skin contact, exclusive breastfeeding, early discharge, and regular follow-up. Supplementary nutrition, which is feeding a baby formula or other food in addition to breast milk, is not a part of KMC or kangaroo mother care as it goes against the principle of exclusive breastfeeding. Next question: following death, the subjective response surviving experienced by the loved one is called option A, bereavement. Option B, mourning. Option C, compliance. And option D, grief. The right answer here is option D, grief. Grief is the natural emotional response to a significant loss often experienced after death of a loved one or other significant loss. Bereavement and mourning are the part of grievance process. Next question: delivery of baby happens in which stage of labor? Option A, first stage. Option B, second stage. Option C, third stage. And option D, fourth stage. The right answer here is option D, second stage. Let us see the stages of labor. First stage, dilatation of cervix. Second stage, delivery of baby. Third stage, delivery of placenta. And fourth stage is recovery stage. Tip is 1C, 2B, 3P. 1C means 1 is cervix dilatation, 2 is birth of baby, 3 is placental delivery. And the mechanism of labor in order is engagement, descent, flexion, internal rotation, extension, restitution and external rotation, expulsion. Tip is ED fair. Next question. Nasogastric suction causes which type of acid-base imbalance? Option A, metabolic acidosis. Option B, metabolic alkalosis. Option C, respiratory acidosis. Option D, respiratory alkalosis. The right answer here is option B, metabolic alkalosis. Nasogastric suction primarily causes metabolic alkalosis. This is because NG suction removes stomach acid, which is rich in hydrochloric acid. The loss of this acid leads to a relative increase in bicarbonate or HCO3 in the blood, resulting in a higher pH and an alkaline state. So, NG suction will primarily cause metabolic alkalosis. Next question. Cessation of breathing for 20 seconds is known as option A, respiratory arrest. Option B, respiratory distress syndrome. Option C, apnea. And option D, transient tachypnea. The right answer here is option C, apnea. Cessation of breathing for 20 seconds or longer is known as apnea. Respiratory arrest is more severe condition that involves the complete cessation of breathing and can lead to cardiac arrest. Apnea is a less severe form of or a temporary pause in breathing. Next question. Vascular repair done by which type of sutures? Option A, silk suture. Option B, polyester suture. Option C, monofilament suture. And option D, ethibond suture. The right answer is option C, monofilament suture. Vascular repair superficially for procedures like anastomosis is typically done by using non-absorbable monofilament sutures. Next question. For assessing the gestational age of preterm infant, the nurse should use option A, Palmar crease. Option B, reflex stability. Option C, breast bud size. And option D, head to toe length. The right answer is option A, Palmar creases. The presence and development of palmar creases on the hands are key indicator of gestational age. More creases, especially on the radial side of the hand, indicate a greater degree of maturity and a later gestational age. Next question. In which year the CSSM program was initiated? Option A, 1980. Option B, 1990. Option C, 1992. And option D, 1982. The right answer is option C, 1992. The CSSM Child Survival and Safe Motherhood Program was initiated in 1992. The program aimed to achieve maternal and child health goals defined in the National Health Policy of 1983. It focused on areas like routine immunization, family planning, and empowering traditional birth attendants. Next question. The nurse health educate the group of middle-aged women to undergo which of the following tests for screening of cervical cancer? Option A, BSC test. Option B, ultrasonography. Option C, fine needle aspiration cytology. Option D, pap smear. The right answer here is option D, pap smear. The nurse would educate the woman to undergo a pap smear test for cervical cancer screening. This test involved collecting cells from the cervix and examining them for changes caused by HPV or human papilloma virus. that could lead to cervical cancer. Next question. Patient receiving mannitol drug. Which is the role of the nurse in specific to a patient with mannitol? Option A, monitor therapeutic value. Monitor therapeutic value. Option B, monitor urine output. Option C, patient safety. Option D, diet management. The right answer here is option B, monitor urine output. The most crucial role of a nurse for a patient receiving mannitol is to monitor urine output. Mannitol increases urine production or diuresis, which is why monitoring urine output is essential. By monitoring urine output, the nurse can assess the effectiveness of the mannitol in achieving the desired therapeutic effect. Next question. After the closure, ductus arteriosus is known as option A, ligamentum arteriosum, option B, ligamentum venosum, option C, fossa ovalis, and option D, brecma. Right answer is option A, ligamentum arteriosum. After the ductus arteriosus closes, it is known as ligamentum arteriosum. If the ductus arteriosus fails to close, it is called a patent ductus arteriosus or PDA. Next question. In ASHA, A stands for option A, accredited, option B, auxiliary, option C, assistant, and option D, automized. The right answer here is option A, accredited. ASHA stands for Accredited Social Health Activist. The letter A is accredited, letter H is social, letter H is health, and letter A indicate activist. So, accredited social health activities, ASHA worker. Next question. Which immunoglobulin can cross the placenta and can provide passive immunity to the newborn? The right answer is option A, immunoglobulin G. Immunoglobulins, types of immunoglobulins and the percentage and characteristics are given here in comparison. First one is immunoglobulin G. It is found in 70%. It crosses placenta. That is the peculiarity. Immunoglobulin A, it is 21% found and it is found in breast milk. Immunoglobulin M found in 7% and this is the first antibody produced during an allergic reactions. Then the fourth one is immunoglobulin E. It is very less, 0.5%, and it is found in allergic and anaphylaxis reactions. The first question also mentioning about the immunoglobulin. Please refer that question also for further studies. Next question. The patient is getting potassium correction in 5% dextrose. What ECG changes will the nurse see to stop the infusion? Option A, prominent U wave. Option B, tall peaked T wave. Option C, depressed ST segment, and option D, shallow T wave. The right answer here is option B, tall peaked T wave. The nurse should immediately stop the potassium infusion and notify the physician if they observe tall peaked T waves in ECG. These ECG changes indicate hyperkalemia, a condition where potassium levels are dangerously high and can lead to life-threatening cardiac arrhythmias. Hyperkalemia, ECG changes, you can see the tall T wave, and in hypokalemia, prominent U waves will be seen. So, prominent U waves indicate hypokalemia. Next question. Bishop's score includes all except option A, cervical dilation, option B, station of fetal head, option C, consistency of cervix, and option D, fetal heart rate. The right answer here is option D, fetal heart rate. So, this is a negative word question. All other three parameters are in Bishop's score: cervical dilation, station of fetal head, and consistency of cervix, but fetal heart rate is not added. Except word is there, so not added. That's why it is the right answer. Let us see the Bishop's score. It is containing position, consistency, effacement, dilatation, and baby station. The scores will be 0 to 3 for each parameters and 8 or greater having a chance of vaginal delivery. That is the significance of Bishop score. Next question. During physical assessment of children, asymmetry of the skull indicates option A, hydrocephalus, option B, craniotabs, option C, craniosynostosis, and option D, osteogenesis imperfecta. Let us see the right answer. The right answer is option C, craniosynostosis. Craniosynostosis is a birth defect in which the bones in a baby's skull join too early, causing the asymmetry of the skull. Hydrocephalus, also known as water on the brain, is a condition where too much cerebrospinal fluid builds up in the brain. Craniotabs is softening or thinning of the skull in infants and children. Osteogenesis imperfecta is a genetic disorder that causes bones to break easily. It is also known as brittle bone disease. So, craniostosis is the birth defect in which the bones of the baby skull join too early, causing the asymmetry. Hydrocephalus, water on the brain. Craniotabs, softening or thinning of skull, and osteogenesis imperfecta is brittle bone disease. These all are the different kinds of skull abnormalities, and you have to be careful while selecting the right option among all these similar options. Next question. The umbilical cord is protected by option A, vernix gaseosa, option B, amniotic fluid, option C, blood substitute, and option D is Wharton's jelly. The right answer here is option D, Wharton's jelly. The umbilical cord is protected by a jelly-like substance called Wharton's jelly. Wharton's jelly cushions and protect the blood vessels within the cord. This jelly-like tissue also helps prevent the cord from compressing and allow for fetal movement. So it is kind of shock absorber and it is protecting the umbilical cord. Next question. Richest source of folic acid is option A, milk, option B, meat, option C, green leafy vegetables, and option D, banana. The right answer is option C, green leafy vegetables. The richest sources or richest natural source of folic acid include dark green leafy vegetables, citrus fruits, beans, peas, and lentils, and beef liver. Next question. Disparity in relation between the fetal head and maternal pelvis is called option A, contracted pelvis, option B, malposition, option C, unstable lie, and option D, CPD. The right answer here is option D, CPD, or cephalopelvic disproportion. The term used to describe a disparity between fetal head and maternal pelvis is cephalopelvic disproportion or CPD. This condition can occur when the baby's head is too large to pass through the mother's pelvis, either absolutely or relatively, or when the fetal head is in an unfavorable position. Cephalopelvic disproportion can lead to obstructed labor and may require a cesarean section. Next question. The psychiatric client getting the antipsychotic drugs and the client getting the symptoms of agitation, feeling of restlessness, dysphoria, and difficulty in sleeping. The group of this adverse effect is called as option A, achalasia, option B, dyskinesia, option C, akathisia, and option D, tardive dyskinesia. Let us see the right answer. The right answer here is option C, akathisia. The adverse effect described agitation, restlessness, dysphoria, and difficulty sleeping is known as akathisia. Akathisia is defined as the inability to remain still. Akathisia is a movement disorder characterized by a subjective feeling of inner restlessness and an urge to move, often manifested by pacing or fidgeting. It's a common side effect of some antipsychotic medications. Next question. The relation between fetal presenting part and maternal pelvis is known as option A attitude, option B lie, option C position, and option D station. Let us go to the right answer. The right answer is option C position. The relation between fetal presenting part and the maternal pelvis is known as fetal position. This term describes the specific orientation of the fetal part leading through the birth canal in relation to the maternal pelvis. Next question. This is the last question of this part. Out of the following, which is considered as the positive sign of pregnancy? Option A fetal movement, option B changes of the uterus, option C breast changes, and option D morning sickness. Let us go to the right answer. The right answer is option A fetal movement. Positive and probable signs of pregnancy are both used to help confirm a pregnancy, but they differ in their level of certainty and how they are observed. Positive signs are definitive proof of pregnancy, such as fetal movements, fetal heart sounds, or visualizing the fetus on ultrasound. Probable signs like uterine enlargement and a positive pregnancy test are more suggestive but can sometimes be caused by other conditions as well. So, positive signs like fetal movement, fetal heart sounds, or visualizing the fetus on ultrasound are the definitive signs of pregnancy. We are winding up this session now. We will continue with the next part for mock test explanation series and more videos on nurses exam preparation for various government nursing exams. Thank you all for watching this video. Please like, comment and share and subscribe for more videos. Thank you so much.